Good afternoon, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, and I'd like to welcome everybody to our today's webinar on HPV, What You Should Know, presented in collaboration with Friends Health Connection. HPV, or the human papillomavirus, is a common virus that affects about 14 million Americans each year. In most cases, it goes away by itself, but some HPV infections can lead to cancer. During today's webinar, we will learn more about HPV, how it is spread, and new recommendations for vaccinations, as well as diagnosis and treatment options. Our guest today is Dr. Thangamani Seenivasan, a surgical oncologist at Robert Wood Johnson University Hospital, Somerset's Steeplechase Cancer Center. We will begin today's webinar with 20 minutes of moderated discussion, and then we will open it up to our audience for questions and answers. So, Dr. Seenivasan, thank you for joining us today. Can you start off by telling us and our audience a little bit about yourselves?
Good afternoon, everyone, and thank you, Serena and Community Health and Kathleen, for putting it together. And I'm honored for the opportunity. And I am a surgeon. I am an oncology surgeon. I treat patients with the cancers. And I do robotic and oncology surgery at Robert Wood Johnson University Hospital, Somerset. I'm based at Steeplechase Cancer Center building. So, and as Serena said, I am a cancer surgeon, so I see the complications related to HPV. That's my area of interest.
Oh, very nice. Thank you. Thank you again. So can you maybe explain for our audience what is HPV?
So HPV is an abbreviation of human papilloma virus. As you all know, this is a long word, so we make it HPV. HPV is basically a virus, as the word says. It is a pathogen, disease-causing organism, for some reason not in everyone, but in some. And there are many phenotypes, but these, when they cause diseases, they cause anogenital warts and oropharyngeal diseases in men and women. When I said it's not only causes wart, it also leads to cancerous conditions. That is the reason we are here to talk about.
Okay, very good. So what causes HPV?
HPV, as we talked earlier, it's a virus. Yeah, it's a virus, spreads between people. How does it spread? It usually sexually transmitted, mostly sexually transmitted, but you not necessarily need to have a sexual intercourse for this infection. Even prolonged genital contacts and the secretions and skin contact can also lead to the disease caused by viral infection.
Okay. So, you got into a little bit of how it spreads, but if you can maybe elaborate how it spreads. You said it doesn't always spread through sexual contact. So are there other ways that it can spread? And if so, in what manners?
So the reason I brought this topic is condom protects you from HPV infection. So like I said, it spreads mostly by sexual intercourse, but skin to skin between two people, prolonged contact. That's what I was trying to say. Even around the condom, the skin can transmit the infection. And the reason we see this is people have the idea, I have a condom, so how do I get the infection? You still get an infection. That's the whole idea of this information that I'm trying to provide to you.
Okay. So then you would then say it's primarily a sexually based or transmitted virus in some manner.
That is correct, Serena. That's it.
Oh. So what are the risk factors then for HPV?
Well, obviously, when you say risk factors, it's a sexually transmitted disease, multiple partners, and unprotected intercourse and lack of awareness of the disease is actually the risk factors, because you do not have symptoms from the disease itself, the infection. You get only complications that you see as disease later. So basically, you do not have any symptoms from this disease. So the awareness, the information is the most important, probably, to prevent these risk factors.
Okay. Very good. So, as mentioned earlier, HPV can lead to the development of certain types of cancers. What cancers are associated with HPV?
Correct. So, Serena, HPV can lead to cancerous conditions and non-cancerous conditions, like you said. So, I'm going to elaborate on the non-cancerous conditions, which are anogenital warts, which are painful and difficult to treat. In addition to the warts, on a long term, a chronic, persistent HPV infection, which is undetectable, leads to cancers. I'm going to list it. Men and women both get cancers, and men and women both get HPV infection. So what are the cancers? Cervical cancer, probably one of the leading cause related to HPV infection, majority of them. Anal cancer, penile cancer, vulvar and vaginal areas cancer, and also oropharyngeal cancer. So these are the list of cancers you see. And also this virus has many phenotypes, which is outside this topic of discussion. That most of the phenotypes that causes the cancer and warts, we already knew from our studies.
Oh, very good. Well, thank you for that very broad explanation. Excuse me. So there is a vaccine to prevent HPV, correct?
Yes, there is, Serena.
Sorry, forgive me. So can you explain who should get it and when?
Well, obviously, there's no really a good treatment for HPV infection. No treatment works. So the prevention is the best. We obviously need to treat the complications that develop from persistent infection, which is warts and the cancers we talked about. So the prevention is the best. Like Serena comes straight to the point of vaccine. Yes, there is a vaccine, and how valuable it is. I can elaborate a little bit. And even before I step into the vaccine part, just want to make everyone know there's no really a test for HPV infection, and especially for genital oral infection in men. And there are tests sometimes, but it's not really detects an infection very well. Now, the question that Serena talked to me is vaccine. Yes, there is a vaccine. So you're all aware of that these are being advertised in the public media, and you're all aware of many names. And I think there are more than one type of vaccine. As we are growing and developing, we have developed what we call as polyvalent or 9-valent vaccine, which is probably the popular. So WHO and US has different parts of the world, different vaccines. So instead of knowing the names, I'm going to say HPV vaccine, best available, that's available in the country is being given to patients.
Okay. So is there a test for HPV?
Well, repeated, there's no real test. The test that detects the later complications like cervical cancer, screening, pap smears, there's no such a thing as a test for HPV infection.
Okay, so then how is it diagnosed? You started to mention like, pap smears and things like that. So how would you diagnose HPV?
There are some tests. I'm not an expert on it. The point is, as we talked earlier, the infection is not symptomatic. So people don't go look for help until they develop the complications. We have tests for the complications, like a pap smear for cervical cancer. And when people develop warts, obviously we can clinically diagnose.
Okay, sounds good. So what are some of the treatment options that are available for HPV?
Well, Serena, since you asked the treatment, like I said, prevention is the best treatment. Now, Serena asked earlier, which I've been completed the answer to the question. Yes, there is a vaccine. Who should get it? Now, the most important highlight I would like to tell is the vaccine doesn't work if you have an infection. So the vaccine should be given before you get an infection. So how do we get the right timing? So it's basically prior to any sexual exposure. Worldwide, there are different ages being used. And I can tell you in Australia and New Zealand, age 9 to 26 is the age that's being used. WHO recommends the same. I mean, why would a 9-year-old go? Probably that's the best age to prevent before any exposure. But we see increasingly 12-year and 15-year-old are being targeted in pediatrician's office. That's probably the majority of the group. So it's important it works before you get the infection. If there is an infection, it doesn't make any difference, although increasingly we see some studies, some improvement, but not really good.
So let me ask you this though, why you said, yes, prevention is the best option. What if somebody contracts HPV? Then how do you treat it? You know, yeah, you want to prevent it. You don't want them to get that virus, but what if somebody does get that virus? Then what do you do?
Well, it's a good question.
So, antibiotic or?
There are, is there a medication for HPV infection? That's probably, you know, I do not treat the patients with the HPV active infection. I am aware of no good treatment. Either we are talking about, Serena is talking about some antiviral medications, or there is anything that's effective. So unfortunately, that's a reason it's hard to get rid of the infection. That's why it's become a persistent viral infection. Now, is there any treatment studies being developed? Yes, there are studies, there are antiviral agents being thought about, but I am not aware of anything. Somebody comes with it. Like I said, the problem is you don't have any symptoms because nobody comes until we see the complications like warts. It's hard to treat. Every time the dermatologist, STD specialist excise them, treat them with the medication, they don't go away. They tend to come back. They're painful, they're difficult to treat. As surgeons, gynecologic cancer surgeons see them as cervical cancers, or in pap smear as a pre-invasive cancer. Or when patients come with anogenital cancer or penile cancer, we know them. In my practice, when I see my patients, usually patients come with a neck mass. When we biopsy them, they are confirmed to have a oropharyngeal cancer from the sexual exposure in the oral cavity. So when these days, modern days, we can tell this comes from, is it HPV related? There are tests. So those are the patients I treat them. So unfortunately, the treatment I can only explain is the complications of the persistent HPV infection, which is asymptomatic. So we see the complications, not the actual infection in the office.
Okay. So for you then, it's mostly surgical intervention. Would that be correct?
That's correct. One of the known cause for cervical cancer, oropharyngeal cancer, is HPV virus infection. So our goal is prevent the cancer. How do we prevent the cancer? By vaccination. If anything, I like to leave a message today is both boys and girls should get the vaccine, number one. It's not only for the girls. Now, where do we get the age? 9 and 12. So countries like New Zealand, Australia, and Denmark, even Canada now, it's part of the universal vaccination health program for their country. So they get over 60% of them are vaccinated. You may think only 60? When they exceed 60, there is a huge benefit. There's a reduction in HPV infection, warts, and cancers. That exponence is coming to close to over 90% in those countries. Unfortunately, there are people in our country who don't believe in vaccines, who say their daughters and boys are not going to be sexually active. And so many explanation studies have been done. So we are averaging 30 to 40%, which doesn't benefit to prevent cancer, but we certainly can improve on it.
Okay, very good. Now, there was something you also said that I wanted to ask you about. So you said that really with HPV, there is no signs and symptoms, but wouldn't the anal genitalia warts be a sign and symptom before surgical intervention?
You got a very good question. So like cancer, wart is actually it takes a long time to form a wart. And it's just a diagnosis you can make. You're right. It helps you to make a diagnosis, this person has HPV infection. It doesn't itself is a diagnostic test. That means the patient had a persistent HPV infection sometime. So like cancer, when we diagnose cancer, this person had it. So we can go back and say this person had, but it itself is not an immediate sign. It's not like other sexual transmitted disease. People get a soreness in their genitalia. You do a test, we know it's positive, we have a treatment. Here, it's just late complication we see.
Okay, late complication, very interesting. So is there anything else besides the vaccine you wish to share with our audience about HPV?
Well, look forward, we all look forward for more studies, more research, better vaccine. This is not a perfect vaccine. But certainly, I would like to say it's good in preventing cervical and vaginal cancer, and which we see the effects already in New Zealand, Australia, Denmark, and it's very encouraging. And there's not many cancers we have vaccines. This is one of them. And so this is good news for all of us.
Good. Okay. So I would like to open up the webinar to questions from our audience. If you have questions for our physician, you can go onto the chat feature and actually type your question, and we would be happy to have the doctor answer any questions at this time. So, Dr. Seenivasan, out of curiosity, as our audience is, typing some questions, what has overall when you say area of expertise with HPV, it's more on the surgical intervention side of medicine, would you?
That is exactly correct, Serena. So,
okay.
I'm not an expert in vaccine. I'm not an expert in HPV infection. My clinical end is actually very unfortunate when they come with the cancer from persistent viral infection that was undetectable, that was not treatable. That's when I see them. So my patient population is largely men who practices oropharyngeal sex. The oral sex leads to persistent viral infection in their pharynx and oral cavity. That infection on a long term gives them cancer. The first time I see them is when they come with the lymph nodes in the neck. So that's one type I see. I do see patients with the anal cancers, and which are obviously from persistent anogenital infection and anal intercourse. So heterosexual and homosexual men and women we see. And most of the time I work sometime with my colleagues who treat this vaginal and vulvar and cervical cancers, which is not my area of expertise. Although I treat few patients a year with the head and neck cancer, to me, my message to everyone is we don't need to see this cancer at all. It's preventable. So that's probably, my goal is not necessarily to treat cancers, prevent them. And patients with advanced cancers, my goal is also to make them have a good quality of life. So everybody thinks a cancer doctor is only treating cancer. It's not our goal. Our goal is to prevent and to treat, as well as people who suffer. We don't want them to suffer. We want them to good quality of life at the end of their life.
Oh, good. Thank you. So on average, how many cases do you see in Somerset County or here in your practice annually?
So I am one of the few doctors who take care of this head and neck problem. So there's a large section of them travel to the ear, nose, throat doctors too. So I would say I see 2 to 3 patients head and neck cancers in my practice. That may seem very small, but we are a small community, and HPV cancers are still smaller in number, so it's still a lot. But the gynecologists will be seeing more of this than I do.
Okay, very good. So I just waiting for a little bit more. Okay, so the question is there anybody who should not get vaccinated, who should not get the HPV vaccine?
Are you talking about pregnant patients, the person asking the question? Are we talking about anybody with the immunocompromised? These are the questions I can answer, but basically, sometimes they ask, oh, should a pregnant woman get a vaccine? So that's becoming difficult, but people do not believe it's a problem, but there are not studies done on it. Sometimes immunocompromised patients, if they get a vaccine, again, there are not enough studies in it, but careful evaluation by doctor based on the benefits, we do. I mean, the other question is, someone who's been sexually active after the age of 26, should they get a vaccination? These are all controversial topics. Since we don't have a real evidence who has infection, who doesn't have an infection, I could say there's no harm done by vaccinating people, but ideally we want to target 12 to 15. Even better is 9, because you don't want any prolonged genital contact, anything. It's a very big, difficult question to answer. Who shouldn't get vaccination? If somebody is already infected, has warts, I don't know how it's going to help them. Having said that, there's not one virus we know. Most of, if I can explain, flu season, some people get vaccine, but we still can get flu. There are so many strains. The scientists figure out this season, these are the strains going to see. They make the most common viruses vaccine. But you can still get uncommon viruses. So people believe that patients with warts can get vaccine because there are other HPV virus subtypes they can prevent. But we do not have all the answers for that. But it will come soon. All the answers will get soon from the studies and research.
So are they saying that this vaccine, if you get your child vaccinated at 9 or when they turn 13, that's going to last them and protect them for the rest of their life?
Right. As far as we know, it's a lifetime protection. And it's not, like I said, 100%. It's not perfect. It covers over 70 to 90% of HPV viruses we treat now. The common strains that cause cancer and warts. So it's not 100%, but you have to use additional protective measures and other precautions.
Okay. A question from our audience. Are there any other ways to prevent the contraction of HPV other than the vaccine or condoms?
It's not really. These viruses are not preventable infection. So vaccine, yes, the best probably available. Condoms generally recommended, but again, condoms I mentioned, you can have the skin around the condom can hold the virus. So condoms protect most of the sexually transmitted disease, but they are again not 100%.
What about abstinence?
Well, that's a totally different topic. I don't know. How can you recommend an abstinence forever? So, I mean, definitely the risk factors are multiple sexual partners, unprotected sex. You know, that is definitely a risk factor that will reduce the incidence of infection. But like I explained, is always the infection is unsuspected. It's not evident who has it, who doesn't have it. So it affects all socioeconomic status. It all affects all people, men and women, heterosexual and homosexual. So
another question is, for those individuals who get cold sores on their lips, is that considered an HPV virus?
No. That is a herpes. Herpes itself is a herpes simplex, herpes zoster. Those are all different viral infections. They are very well treatable by sore creams and medications, antiviral medications. It's easy to mix up these two. HPV is not herpes. So it's different.
Okay, thank you.
That's a very good question. Whoever asked. So people mix it up easily. So.
Yes, it's very, very confusing, all these viruses. I don't know how you do it as a physician. You got to know all of them. So, well, very good. Well, that is all. It looks like that's all the questions we have from our audience. So having said that, then this is going to conclude today's webinar. So thank you everyone for joining us. Just please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from your physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/Somerset. Thanks again, everyone, and have a great day.
Thank you, Sarina. Thank you.
Thank you, Dr. Seenivasan.
Thank you, Catherine.